I'm really pleased to welcome Brendon Stubbs from King's College London. So Brendon is going to take us into another domain that Peter highlighted earlier as being relevant and important for depression and for mental health, namely exercise. So Brendon is a clinical academic physiotherapist at King's College London with special interest in physical activity and mental health, as well as the mind-body interface and what's impressively called meta-research, which I think is bringing large data sets together and dealing with them. Brendon trained in not only physiotherapy, but also neurorehabilitation, pain medicine and rehabilitation was the topic of his PhD, actually. He works both nationally, but with many international collaborators, has published over 500 papers, which is considerably more than me, actually, Brendon. So I think you look much younger than me as well, so it's impressive. A major range of his studies have been, on exercise and mental health, including both depression and anxiety and mechanisms, as well as trials and meta-analyses. So, really an expert in this area. He's also done a lot of work in science communication, and so I'm really, really looking forward to hearing this. Thank you very much for taking the time to come here.
Thank you so much for the kind introduction. I'm afraid it doesn't get any better from there. It goes downhill after that introduction. And thank you so much for the invitation and the great work that you're doing with the foundation. Thank you, everybody, for being here, everybody online. It's a real privilege. I've learned a lot today, and I'm really at the sort of the people end of this. I deal with people on a regular basis who are struggling with mental health from early on to sort of later on with life. And it's an area which I'm really passionate about as well. I should warn you in advance, there's two things that are a bit dangerous at this point. I've got a really fantastic record of sending people to sleep when I talk. And like I gave my first talk, I think newly graduated in front of 3 people, I think was there. I think 2 of them fell asleep. And I used to get really, really like anxious about it. I think, gosh, am I that boring? And some people have said that it is true that I am that boring. But then a psychiatrist friend said to me, don't worry about it, Brendon, as we've heard today, of Daniel, sleep is a really good thing for people. So, if you do fall asleep, and I continue with my wonderful track record of sending at least one person to sleep, I won't take it personally. And then another sort of thing is, I'm normally on like a breakfast slot or after lunch, and obviously that's quite a difficult time, but coming after having a drink slot is also quite a challenge. I don't know whether my friends are lying or not, but they often sort of tell me that when they've had a few more drinks, I am more interesting. So maybe that might counterbalance my sort of boring and my ability to send people to sleep. So let's see how this goes. But it's good to be here. So what would I like to share with you today? And really, I'm looking at this from an exploratory viewpoint, and I really welcome questions as we go along. I'm just sort of learning very much in this area, and I really wanted to sort of focus on these sort of 2 key fundamental areas, which I'm really interested in, is what's the relationship between physical activity and the promotion of better mental health throughout the lifespan. And by physical activity, I'm defining that, and the literature defines it as any bodily movement which increases energy expenditure. So that could be, it could be gardening, it could be dancing, it could be me moving around on this stage. And then there's exercise, which is a subset of physical activity where we specifically go out to improve our physical fitness. And both are really important and often used interchangeably, but they both have really important mental and physical health benefits. But I'm going to talk about that today. And I'm also going to talk about the evidence to say not only how may this help protect against the emergence of depression, a bit about anxiety, and then what is the evidence as an actual intervention when we look at trials, and what are some of the mechanisms within that. And just to sort of say, please view what I say with some white hat bias. I spend a lot of my time in this area. I try to stick to the data, but obviously I'm invested in this area on a personal level. I will present data. I will try and keep my opinion to a minimum. And I'm funded by an NHR fellowship, and I've written guidelines on the importance of physical activity and exercise, and a few other things, supervising PhD students. So, please view it through rose-tinted glasses, and I'll try and stick to the data, but it's just important to outline that for you as I go forwards. So I don't want to spend too much time on this because far more eloquent people than me have gone through this today, but for any of you who've experienced or know someone who's experienced depression, it's a very complex, multifactorial factor, and I've learned new things about the onset of depression through some of the talks today, and some of the mechanisms which I didn't even know existed. And obviously there's a genetic component which we heard very eloquently earlier on today, and there's environmental factors and gene environment interactions, some of which I've learned again today. And there's a big part of environmental risk factors, or factors which happen and can be potentially modifiable. And we looked at this in 2018 to try and understand all of the meta-analyses that have looked at individual risk factors to say how good is the evidence for each individual risk factor on its own as being independently, as much as you can in observational data associated with depression. And we did this with Professor John Ioannidis. I don't know, has anyone heard or come across John Ioannidis? Yeah, so he's done lots of things, but he's done, amongst many of his accomplishments, the most downloaded research paper of all time, which has got a quite provocative title. You name it, chemistry, biology, medicine. It's the title was "Why Most Published Findings Are False," and it's a good read. And he really looks at how good is research, and he helped us with this particular piece. And again, depression is very complex, multifactorial, but we wanted to look how good is the epidemiological evidence to try and understand this. And I'm not going to bore you with a stats lesson because I will also send myself to sleep, but there's a number of statistical tests when we apply to this, which is a hierarchy of rating the quality of the evidence to say how convincing or highly suggestive or is there good evidence to say that an environmental exposure is related to an outcome. And there is a ranking within this and numerous mathematical tests which have been tried and tested in many different conditions. And we identified at this time, sort of 2017, 2018, 134 meta-analyses that all independently had investigated an exposure, an environmental exposure, and said this could be related to depression. Anyone want to guess how many met the criteria of what we called convincing evidence in terms of meeting the significant threshold, not having evidence of publication bias, small sample size? How many different exposures out of 134 that were pulled in meta-analyses met the criteria for convincing evidence when we looked at prospective studies in the published literature? 10? Oh, we've got some optimists. Anyone else? Higher, lower? None? Okay, yeah. It's good, I like it. So, so when you look at this and you look at sort of abstracts and what people do, and we all know the limitations of p-values and this magic threshold of p equals less than 0.05, 109 of these, said they were nominally significant. And you may think, wow, look at all of these 109 factors that could contribute towards depression. But when you apply all of these tests, which I'm happy to provide you with details on earlier, 8 met the criteria for convincing evidence, and there is a hierarchy within this, which I won't go into now. And again, this is based on meta-analysis which had been pulled. And again, there's many things which haven't been considered. There's many other things which could contribute to this. But at this time of published meta-analysis, when restricted to prospective cohort studies, these are the factors which met the criteria for convincing evidence. And that's not to say at an individual level, it's much more complex than this, but this is just to say that when we looked at the data from a population cohort level and we looked prospectively, these are the factors which were associated with an increased risk of depression. I've been invited to talk about physical activity and exercise, so I could just say my talk's finished, I might as well go home. There's no evidence, but there wasn't a published meta-analysis at that time, so I'm going to talk about that shortly. The benefits of movement. I'm not coming up with some new novel, mechanism or new, pathway or new medication or something else. People, far more eloquent and intelligent than me have been saying about the benefits of movement and also nutrition for a really, really long period of time. But it's only quite recently that the science has really started to catch up, as has the sort of public policy and the emphasis within this. And I'll just walk you through some of this more generally before we get into the context of mental health, specifically depression and anxiety. So this is a little bit old now, but it's still relevant and it emphasizes the point. So this is not looking at early deaths. This is looking at what contributes to the UK's health global burden of disease and what are the modifiable risk factors which are contributing across the UK, published in the Lancet. And what they found here is, unsurprisingly, tobacco smoking and all of these conditions is a modifiable risk factor which is consistently contributing to an increased amount of global burden. Then you've got high blood pressure, high body mass index, and then you've got physical inactivity or low physical activity. And then you've got sort of nutrition here in terms of low fruits, cholesterol, and diet in low in seeds, and many of these interact with each other. But this goes to show that not only in terms of risk of mental health burden, but also premature mortality, that not being active is not very good for us. Just to prove Plato's point, we've had to wait all of this time. And before I get into specifically the role of mental health, I'd just like to emphasize again a point which you'll all be very familiar with. This is something which we published in 2019. People with lived experience, carers, psychologists, psychiatrists, epidemiologists, public health specialists, all manner of different people, and even people like me, random physiotherapists, to look at how important is the physical health of people that have mental health diagnoses. Thank you. So how important is the physical health of people that have mental health conditions, and how important are lifestyle approaches? And we consistently find across the age span that we've got lots of research showing an increased prevalence of physical health burden, starting early on, increasing as we go on, and lifestyle, physical activity, nutrition, smoking cessation interventions can play a really important part to improving the physical health, but also the mental health of this population. And we often talk about the scandal of premature mortality, and this is a really serious issue. And many of these early deaths, broadly 70% are attributed to individual or multiple long-term conditions or multi-morbidities. So we've got much more to do. So how good, cardiovascular disease, just picking out one example. So how good is physical activity and exercise to reduce the risk of cardiovascular disease? And we've published papers, and other people have published papers too, looking in depression, schizophrenia, bipolar disorder, showing that if you have these conditions, if you don't have cardiovascular disease, compared to people without those conditions, you're much more likely to develop it. And if you've not developed it, you're much more likely to develop it in the future. And if you do develop it, you're much more likely to die from it in the future. The reasons for that are complex, multifactorial. We've got diagnostic overshadowing and a whole range of other factors. But one of the main points is, in this instance, just picking out one example, cardiovascular disease is a big issue. So how good is physical activity and exercise in the treatment of cardiovascular disease? A major concern for people with a mental health diagnosis. John Ioannidis, again, who I mentioned earlier, did a really nice paper in the BMJ, published almost 10 years ago now. And he wanted to answer, a relatively simple question and say, if you theoretically and did a meta-epidemiological study and compared head to head some of the best pharmacological treatments in the general population for cardiovascular disease, such as statins, ACE inhibitors, beta blockers, how good is exercise for cardiovascular disease, pre-diabetes, stroke? And what Professor Ioannidis broadly found in this paper is that exercise across all of these conditions is broadly as effective as these common medications which we give to people who present with cardiovascular disease. This is subsequently backed up by quite substantial and large trial sequential meta-analyses, so where we're comparing indirect and direct randomized controlled trials of exercise versus common pharmacological interventions for hypertension, cardiovascular disease. So, there's building momentum just for cardiovascular disease, that exercise, putting aside, we've not even started to talk about mental health symptoms yet, that this could be really important for the people which we're really concerned about. And again, this is not going to be groundbreaking or revolutionary to any of you, but unfortunately, we've had to do some quite common sense research to help and make people listen and understand. And we've shown, unsurprisingly, that if you look at young people with depression or young people with schizophrenia or young people with bipolar disorder or people who've had the condition for a longer period of time, people have more difficulty engaging in physical activity, engage in much lower levels of physical activity, have difficulty engaging in regular physical activity, and substantially lower levels than people of similar age, gender, matched for all of these other factors, minus the condition. So, when I go on and emphasize about, leading causes of death in this population, not even talking of mental health symptoms yet, this is concerning to us, and we want to do something about it. And physical activity could be a real double win as part of a routine care for people. And again, I'd like to say, and I don't want this to be misrepresented or misrepresent myself, I am by no means saying physical activity is a cure-all and prevent-all for all people with mental health conditions. It is part of a solution and part of a toolbox to help people. And I believe, based on the data, that it can really bring added value. So what do we know about how active people are in their daily lives, physical activity, and people's future risk of depression? And we published this paper in the American Journal of Psychiatry in 2018. And we looked at young people below the ages of 18. We looked at working age adults and old age adults, and people were all cleared from any elevated symptoms of depression or any other mental health comorbidity. And we followed them up on average for 7.5 years, over 260,000 people. And we wanted to understand, does your level of physical activity influence, or is it associated with your risk of depression in the future, or a clinical diagnosis of depression, whilst we adjust as best as we can for all of the other factors which would contribute to this? And essentially what we found is that regardless of whether you're a young person, you're a person of in your early 20s like me, or you're someone who's slightly older, I'm just joking about my age, by the way, that being more active in your daily life was suggestive of protection against the emergence of depression in the future by around 20% compared to people who were least active. And again, I don't want to bore you with the limitations of observational data. This is suggestive, and we found evidence of a dose-response relationship in that people who met the recommended guidelines of 150 minutes of moderate or vigorous physical activity over the course of a week, there's around a 35% reduced risk or odds of this in the future. And about a month ago, Felipe Schuch, who led this paper, who's a professor in Brazil, published another paper, which I'm not a co-author of. I'll let that one go, but it's a much better paper than this one. They did a really nice dose response meta-analysis and looked at different modeling of different types of physical activity and how this changes over time, and really superseded this paper. It's published in JAMA Psychiatry, and again found that there is this dose response relationship between being more active and different trajectories from young people to the risk of depression in the future. And this was regardless of geographical location, if you're in a low and middle income country or if you're a high income country. And so this is suggestive there is a prospective relationship. A great now doctor, PhD candidate who finished, Aaron Condola, at UCL, did this paper about 18 months ago in Lancet Psychiatry, and it's a really great paper. And what Aaron did was looked at objective or device-based measured physical activity across the ages at the bottom here between 12 and 16, and looked at in green here moderate or vigorous physical activity, in red light activity, and blue sedentary behavior, and here is minutes per day. So this is reliable physical activity in an objective device measured behavior. Unfortunately, a lot of this, much in line with like the dietary and nutritional information, is based on self-report. So this is really good and novel information. And what you can see over this time period, before I talk about the relationship with depression, is this representative cohort from Alsbach. I think people have talked about this earlier on today, is that extremely low levels of moderate and vigorous physical activity. This is a really representative sample, and you can consistently see almost none amongst these young people, no shift. And you can see this increased trajectory in people sitting, being sedentary more. I'm going to talk a bit more about that in the context of mental health, and this decline in light activity over time. And what Aaron sort of found is sort of key headlines within this is that young people 12 to 16 who were persistently engaged in high levels of sedentary behavior were much more likely to develop depression in future down the line. And he did some really sort of fancy substitutional modeling, which he had to explain to me carefully quite a number of times so I could understand. And what he found was that if you look at sort of age 12 and you substituted an hour a day of this increased sedentary behavior with light activity, you could get, broadly speaking, around a 10% reduced risk of depression in the future. So this starts to build and add sort of credibility about the evidence for physical activity and movement, being a concern for people, more generally, but, also a modifiable factor which we can adjust to potentially improve people's mental health going forwards. And Aaron also did this piece in the UK Biobank data in 60,000 people. Again, this is prospective cohort of people. This is an older sample. And Aaron did something very similar, but he also looked at depression and anxiety. I should say, I've not put the slides up. Aaron did a similar thing in the Alsbach and showed a similar relationship with anxiety that was published in Psychological Medicine. But this is looking at older adults in sort of middle age of sort of 40s, 50s. And Aaron found that, interestingly, if you replace 60 minutes of sedentary time with light activity, and that tends to be an activity where you're moving quite gently, but you're not becoming out of breath, then you can get, a small amount of reduced risk of depression over a 7-year follow-up. But if you can change this by moderate or vigorous physical activity, and to place this into context, that may be an activity or a movement. It could be gardening, where you're starting to get a bit slightly out of breath, or you could be running or playing tennis, and you're able to maintain a conversation, but you're becoming more breathless. And he found, sort of 12.5% on average reduced risk just from an hour a day. And he found this interesting, factor here that there may be some, increased risk for changing light physical activity. And myself and David Osborne, who's a professor at UCL, and Joseph Hayes are a bit, uncertain about why this may be. Is why may people who are doing more light physical activity be more anxious in the future? And we sort of wondered why this may be, and perhaps it could be a marker. If people are a bit anxious, that they may be a bit more fidgety and moving, particularly if you've got a device on. We're not sure, but what we were clear is that, again, if people are moving at a more moderate intensity, we see this reduction in the risk of anxiety in the future. How's everyone doing for sleep and everything? 100% on board. Never too late to get the benefits. So, I've heard a really good explanation of Mendelian randomization studies earlier on. I've never quite understood it so well, so I'm not going to go into talk about the methodology of this. But there's been some really great Mendelian randomization studies. This is one done by Carmel Choi, who's at Harvard. And she used the UK Biobank data. And essentially, she wanted to understand, using objective physical activity data, is there a causal relationship between being more active and a reduced risk of depression in the future? Or does it go the other way? And she found that there is a causal pathway between being more active and a reduced risk of depression in the future, but there wasn't a relationship going the other way. So this adds sort of weight and depth to the observational data, which is increasingly substantial, which are presented in the earlier slides. And to top this off, I've not put the paper up there. She looked at a large cohort of people, 30,000 people, who were all genetically predisposed to having depression in the future. And she looked at objective levels of physical activity and followed them up over a 4-year period and said, for all of these people who are genetically equally predisposed, does physical activity influence your risk of developing depression in the future, or is it purely determined by your genetic makeup? And she found that in this genetic at-risk group, that those who were more active compared to least active of equal genetic predisposition were less likely to develop depression in the future. And again, that was a Mendelian randomization study. So we're starting to build this picture that this is, quite important in terms of an independent risk factor from early on, 12 years, we've got data, throughout the life course. I mentioned this earlier on, so I'm not going to labor the point, but we also looked at the relationship between physical activity and the risk of anxiety and stress-related disorders in a prospective way earlier. Felipe Schuck led this again, so prospective data, people who did not have anxiety or stress-related symptoms at baseline, and found that people who were generally more active in their daily life were less likely to develop anxiety and stress-related conditions in the future. Now, I'm going to move on to a few randomized controlled trials now. And it's a bit like lectures like this, or like days like this, where you get people sitting and see what happens and how people feel. But this is interesting, what happened in this study, and I'm not sure how they got ethical approval, but they did. So let me talk you through this. So this was people who were in their early 20s, free from any mental health or physical health comorbidity in a university setting, who were ordinarily active. And a randomized control trial when you've got PHQ-9, so mental health symptoms here, and people were randomized to stop structured exercise in orange, or blue, just to carry on normal with their structured exercise. And after a week, their mental health symptoms are measured again. And what you can see here is this increase in mental health symptoms from this group who were asked to sit still, not move, not engage in regular exercise, whereas this group who carried on as usual, they maintained the same. But thankfully, this group who paused exercise, structured exercise for a week, returned to normal in terms of their mental health status. So this again, early 20s, a key time for intervention. University students, what happens when we stop people engaging in exercise? We place this in the context of all the things we've been through in terms of COVID, etc. This starts to build the picture that not only is this observationally important, not only is this important for a Mendelian randomization study, but there is some small, this is about 60 sample size, randomized evidence to suggest that this enforced stopping of exercise may not be good for people. A slight bit of comfort, this is only based on observational data, which we've done in Swedish data, is we've looked at the differentiation between what we've called active sedentary behavior and passive sedentary behavior. And is there a risk in terms of the cognitive load and your risk of developing depression in the future in children and young people and in working age adults? So active sedentary behavior may be doing things such as working on a computer, cognitively engaged, listening to a stimulating lecture like the ones earlier, maybe not mine. And passive sedentary behavior would be things such as, gormlessly staring at a TV and not being cognitively engaged, or gormlessly perhaps scrolling social media. And it appears from the observational data in the early stages, and it suggests that active sedentary behavior does not appear to be associated with an increased risk of depression and anxiety in the future, whereas passive does. So when people are just not engaged and gormlessly engaged in sitting and not moving. Of course, it's complex, but that's just some preliminary data which is coming out. Another study was done at UCL, which repeated the earlier randomized control trial, which I mentioned in terms of asking healthy young people not to engage in sport and exercise. And they found the same thing published in the British Journal of Psychiatry, but they went a step further and said, why? What could be the underpinning mechanisms of this? Clearly, it's complex and multifactorial. But they found that there was alterations in some of these inflammatory markers, particularly interleukin-6, and numerous speakers have alluded to and elaborated on just how important inflammation and these inflammatory markers are for the onset of mental health conditions more broadly. And if you look at the exercise literature, exercise up to a point, not for people who exercise in excess, is a really potent anti-inflammatory mechanism. So that could be one of the mechanisms through which exercise could exert its mental health benefits going forwards. So I've talked a lot about prevention in terms of bodily movement, but we've also been very interested in how your heart and lungs function and work, cardiorespiratory fitness. So this is really how your heart and lungs respond to any stress which is placed within them. And this is quite malleable within young people, as opposed to like body weight and body mass index, which is very difficult and complex for all of us to change. Cardiorespiratory fitness it can change quite quickly, and it is a better predictor of diabetes, cardiovascular disease, and premature death than body weight and body mass index. There's big data in JAMA and major publications showing that if you are overweight and fit, You are less likely to die early and have all these other comorbidities compared to being overweight and unfit in terms of cardiorespiratory fitness. So whenever I'm working with people, we really emphasize the importance of focusing on fitness, focusing on movement, because it's much more malleable and it's a much better predictor of health outcomes in the long term and changeable in the short outcome. And again, we showed within this that people who had higher levels of fitness were less likely to develop depression in the future. And Aaron presented a number of papers earlier on, looked at what's more important. Is it more important to look after your cardiorespiratory fitness, bit of a false dichotomy, or is it important to stay strong? Both are really emphasized in World Health Organization guidelines, etc. They recommend having, strength training days, and also in terms of getting active, getting your heart and lungs working. And unsurprisingly, both have beneficial effect in terms of preventing, being associated with the reduced onset of depression and anxiety. But when you have these co-occur in terms of higher levels of cardiorespiratory fitness, higher levels of muscular strength, there is an increased beneficial reduction in terms of anxiety and depression in the future. So it's not just about movement, it's also about getting your heart and lungs working, but also focusing on muscle strength too. Some people don't often put this quite as politely as this to me when I talk about exercise. I think it's a really valid point. Because for anyone who's really struggling with their mental health or not in a great space, it's very easy to sort of say, let's get up and let's do some moving and let's get going. But it's really difficult for people. For any of you who've experienced depression, anxiety, or know somebody, it can be really, really difficult. And thankfully, there is some really good research which has been underpinned by lots of people, including David Van Kampvoort, who's a professor in Leuven, who's looked at lots of different types of motivational frameworks, and particularly how do we help people who are really struggling with their motivation. I mean, that's an issue for so many people, regardless of given mental health condition, in terms of initiation and also maintenance in behavior. And how do we help people move from an external motivational factor, such as an annoying physiotherapist like me saying it'd be great to go out for a walk today, to moving along to having a positive experience and saying, actually, yesterday we went out for a walk and we did 5 minutes. I felt better. So today, I'm going to go out today. So David's done lots of work on this, and I haven't got time to go into all of the details of this, but there is good evidence around behavior change, initiation and maintenance within this particular context. So I'm going to move on to treatment now. I've spent a lot of time talking about prevention across the age span. And there was a Cochrane review published in 2013. And I gave a quite critical talk in a very balanced, friendly way at the University of York about this Cochrane review. I didn't realize that the editor of the Common Mental Disorders group was in the room, and so were several of the authors. But that's okay. They were very sort of nice about it afterwards and wanted my views and things. So I'm not going to go into it too much, but there was numerous issues with the Cochrane review, and there was numerous issues with the interpretation of it. And unfortunately, for many years after, people continually said, but exercise doesn't work for depression. And the short answer is there was lots of issues with that Cochrane review. It's currently being updated, and Paddy Ekikakis did this very big critique, and it's entitled "Honey, I Shrunk the Pooled Standardized Mean Difference," and it really goes into a lot of the methodological issues that really went into just how the authors did not do a fair representation of exercise as an intervention for people with depression. So we looked at this in 2016 now, and saying when you add on exercise versus weightless control, or other interventions, that exercise can have a really positive effect on people's mental health, whether it be resistance type exercise, aerobic exercise. And when you compare it versus a fair control, it can be a really beneficial intervention for people. And although I'm not a favor of doing this, because I think it's not very helpful, but I think it places exercise in context of how helpful it can be for people. Mats Hallgren did this 3-armed randomized controlled trial in the British Journal of Psychiatry, and he addressed a number of limitations, fair limitations with the exercise literature. He did almost 1,000 people in Sweden in primary care with mild to moderate depression, 3 groups. Everybody had treatment as usual. 1 group stayed in treatment as usual. 1 group had CBT delivered via the internet. 1 group had structured exercise. And many exercise interventions didn't measure depression over a long period of time. This one looked at depression over 12 months, and it had huge sample sizes. And what Matt's found essentially is that when you compare exercise versus CBT, and I'm sure there's not many people here who would not advocate that CBT is a very helpful treatment for people with depression, Matt's found in this very robust trial is that exercise and CBT were equally as effective in terms of depressive symptoms, both from a statistical and clinical viewpoint, and were both better than just usual care on its own. And again, they're both really important approaches, but it just goes to add to the quality of evidence within this. And the NICE guidelines have recently, thankfully finally been updated. I'm going to talk a bit about resistance training now, and I like resistance training in this sense, and also the type that you do in the gym. But more broadly, is we're realizing that resistance training is very, very important for all manner of different outcomes in terms of cardiovascular disease, physical function, frailty in older age, and a very good indicator of early death too. And we've recently become really interested in this in mental health settings. And this is a paper done by Matthew Herring and colleagues. And they found that when you look at all of the RCTs done looking at people with depression across the age span, resistance training can have a really positive impact for people with depressive symptoms when you add on to usual care too. Rebecca Martland, who finished her PhD last year, also looked at another type of exercise and intervention, high intensity interval training, these short bursts of exercise followed by brief periods of rest. Joe Wicks does lots of these types of videos as well, and it's quite fashionable amongst young people. It's not to everyone's liking and taste, but she found that that this is very helpful for people's mental health too. And I haven't put these slides up, but there's also good evidence for other interventions such as yoga, Pilates, and we've published extensive papers on that. And I'll get to some of the clinical implications of this more broadly. And specifically when we look in young people and people at school, adolescents and people below the age of 24, much in line with the older adult literature, when you look at randomized controlled trials, you see that, again, this is an intervention that works. And we're talking about mental health symptoms here. And when I refer you back to many of those earlier slides in terms of risk of cardiovascular disease, diabetes, etc., the potential double win of exercise, or triple win is really, really profound. And Garcia has looked at this issue for substance abuse, ADHD, autism, bipolar disorder, and found that for children, adults, and older adults, across this growing body of literature, there is increasing good evidence that exercise can be a really valuable treatment for people's physical health, mental health, and quality of life. So you'll be pleased to know I'm coming towards the end. No round of applause yet. Yeah, I could walk out and then no one would realize. So where are we? I'm really pleased to say that we're starting to get traction and people taking as seriously. And it's great to be invited to events such as this, where it's really hard, quality science, and there's people like myself who are at the end of human end of doing things with people, and the NICE guidelines have been updated recently in terms of recommendation of exercise. Many people are doing that already. We wrote the European Psychiatric Association guidelines recommending that exercise and physical activity should be a core part of treatment for people with depression, young people, people with bipolar disorder, schizophrenia, for many good reasons, not just because we think it's a good idea and we critique the evidence within that, and people with lived experience, many psychiatrists, psychologists, and etc. For people who may or may not be comfortable or confident in terms of talking to exercise, if you're a clinician, you want to talk to people, this is a really nice framework, which is free, for moving medicine. And it's about how to have like a 1-minute conversation, a 5-minute conversation within a motivational framework to talk with a young person and help engage and motivate that person to become interested in physical activity and exercise. And it's a very good resource to use. So what would I say the optimal exercise program or physical activity program is? I would say always find a movement that you enjoy. And when I'm talking to somebody, and stick to it. There's no point in me saying that you should go to the gym or do high intensity interval training 3 times a week for 40 minutes on a Monday, Wednesday, and Friday, or you should go dancing, or you should go Pilates. I'm very much about, what is something that you're interested in, what you're more likely to do. And importantly, if you're struggling with mental health early on, none of us like to feel we can't do something. I was chatting to Peter beforehand, and if I went to like a dancing class, this evening, for instance, and that was that, I would feel really stupid because I can't dance, and I wouldn't go back again and experience the benefits. But if I went, to go and do something else that I could do, such as, I don't know, playing tennis, and I'm much more likely to go back. So it's always for me, about what is the person able to do and interested in, and breaking down the barriers and saying, this is all about finding a movement you enjoy. You're much more likely to start it. It's important you experience the benefits early on, and then you're much more likely to continue with it early on. There's exciting developments happening now in terms of integration with technology and the metaverse and some other ideas that we're looking at, particularly with young people, which we're really excited about. And before I do take-home messages, I will briefly talk about mechanisms, and I've heard people talking about mechanisms, and I've looked at this report and thought, wow, this is great. But in terms of mechanisms, what we've been looking at, we're realizing within the exercise literature that most of what we've learned is sort of borrowed from other theories, taken from the lab, and or just older theoretical frameworks which haven't been applied and tested in humans. So we think it's quite complex and multifactorial, and not due to a molecule changing or a system changing. And we kind of broke this up into very simply, again, even like biological mechanisms. So we've looked at responses to hippocampal volume, both in the short term in terms of changes in functional magnetic resonance imaging scanners and just 10 minutes of light activity. We've also looked at changes in volume over time. We've recently finished a trial in young children and running with subthreshold depressive symptoms in China, and we found that can stimulate the prefrontal cortex, increase hippocampal volume. We've done another randomized controlled trial looking at BDNF and other sort of trophic factors. Looked at sort of white matter hyperintensities in other people. We've looked at HPA regulation, cortisol activation, oxidative stress, many of the inflammatory markers as well. So basically, we're not really sure, but we think it's a massive combination of all of these individual things, including stimulation of the endocannabinoid system. And there's emerging evidence which we've been looking at and other people have been looking at. And often when I talk to people, particularly in public engagement events, which I have the privilege of doing, and people saying it's a runner's high, it's endorphins, isn't it, Brendon? And I saw that for a long period of time, but I've seen, and again, I'm not sure about lots of this stuff, and that's okay because I don't know lots of stuff. But there's increasing evidence that I've looked at from human studies showing there's some difficulty of endorphins in their own right crossing the blood-brain barrier and exerting their effect. And I think it's well, this is just my own personal view. It's quite reductionist to say we feel good after exercise due to one particular substance, and of course we can't neglect the psychosocial benefits. If I go out and play tennis tonight and I hit the ball well and feel good, my self-esteem improves. If I go and hit with a friend, and there's a social aspect element to that. I feel a sense of mastery in terms of self-efficacy, and I may be around friends also too, and there's that social element. And there's much more going on than just one change in a molecule, and that's the position which I've come to at this particular time. And basically the short answer is I don't really know why, but it does work and we're trying to understand. So what would I like to summarize on from all of this is just that hopefully I've been able to walk through with you over the course of this talk. First and foremost, you've been able to stay awake. If you've not, I hope you've enjoyed your sleep and I hope you feel better. And if not, the key messages are that higher levels of physical activity in whatever form you enjoy, whatever form the people that you work with, you care about, is protective of physical health and mental health today, and also in the future. Clearly, it's not going to, in and of its own right, be the solution to everyone under all circumstances. I'm not aware of any intervention that is for everybody under all circumstances at all times, but can it help? We believe so, based on the observational data, based on the Mendelian randomization data, the randomized controlled trial data. We also, increasingly believe that sedentary behavior and this worrying pattern we're seeing in young people becoming more and more sedentary is concerning, but we can do something about that. We can change it and improve it. And it's not just about moving. Moving's great, but it's also about getting the heart and lungs working and getting people's muscles moving too. Find a movement that you enjoy, that you're able to do, that you're able to master and experience the benefits from, and you're much more likely to do it and experience the benefits in the long term. And I would like to say, just to finish off, thank you very much for the kind invitation. I've really enjoyed spending time with you today. It's been great. I'll let you in. I had a little sleep on the train up, so I'm feeling better on the way. So yeah, I'm feeling better than I did earlier on today. And just thank you for the invitation, the warm hospitality. So many young people, people with lived experience have encouraged me. So many people, carers, and so many bright people have helped me along with all of these slides. And without all of these people, I would have probably had one slide to show you. So I think I will leave it there and just to thank you.